Unit 5, Task 4. 1. ECG.
Your pulse is a bit irregular. I'm not quite certain why this is, but I think we'll have to get a tracing of your heartbeat. I want you to strip down to the waist and also take off your shoes and socks. First of all, this is a completely painless procedure. Are you quite comfortable? It's better if you're as relaxed as possible before I start to take the cardiograph. It only takes a few minutes to do the actual test, but it takes a bit longer to get you wired up. I'm just putting some cream on your wrists and ankles. That's everything ready. Now just relax as much as you can.
2. Barium meal.
Good morning, Miss Jones. This test is to help me get a picture of the inside of your gullet and your stomach so that we can find out what's causing you these pains there. I want you just to stand here while I give you a cup of liquid to drink. This liquid will show up after you've drunk it and will be able to tell me if you have an ulcer in your stomach or duodenum. I'd like you to drink the liquid now, and I'll be taking pictures of it as it goes down. That's fine. Thank you.
3. Crosby capsule.
Now, I'm just going to give you a little jab to help your tummy relax. Just a little prick. OK? That's fine. Good girl. Now, I want you to open your mouth for me so that I can pass this little tube down into your tummy.
Right.
That's fine. Good girl. Nothing to worry about. Head back a little. That's fine. Now, can you swallow for me? And again. Good girl. Now, I want you to try and keep as still as possible.
4. Ultrasound scan.
I'd like you to lie down on this table here. This gel helps to get a contact so that the picture is clear. We'll just rub in the gel a little bit. And now I'll put on the equipment. Try to keep as still as you possibly can.
Okay.
That's good. Now, if you turn your head to the left, you'll be able to see the scan as I'm taking it.
Oh.
As you see, it's just like a television picture. This black part here is the baby's head, and this is the body. As you can see, it's moving around very well.
Yes.
These dots allow me to measure the baby so we can work out when your baby is due. That's everything finished now.
5. Myelogram.
We're going to put a little needle in your back. We'll inject some fluid in, put you onto the table there, and take some X-ray pictures. These will help us to know exactly where the trouble is. Now roll onto your left side. That's it. I want you to roll up into a little ball to bring your knees up and tuck your head down. That's fine. Now I'm going to swab your back. You'll feel it a bit cold. Now you'll feel me pressing on your back. All right? Scratch coming up now. Now you'll feel me pressing in. Okay, that's fine. I'm just injecting the stuff in. You shouldn't feel it at all. That's it. Okay. I'll just take the needle out now. Now just straighten out gently and lie on your front. We'll take the pictures now.
Unit 5, Task 5.
An ECG is essential because it will show any changes in the heart, axis ischemia, left ventricular hypertrophy.
I think a chest X-ray is also very important to see the heart and the extent of the hypertrophy. I would also check the creatinine to see if there's any damage to the kidneys.
An intravenous pyelogram is essential because a renal cause is very likely.
As an initial investigation?
No, after urea and electrolytes and after the creatinine.
It's essential if the creatinine shows something wrong with the kidneys.
Yes.
Yes, both creatinine and urea and electrolytes are required. In this case, I think they're more important than the ECG and chest X-ray because the patient is young, 43, and the hypertension is very high.
Urinalysis too in this case. It's very important.
Yes, it's routine.
We can see if there's any glomerular damage. We may find blood, albumin, casts.
Yes, it's very important.
What about radioisotope studies of the kidneys?
Not essential. But we could do this to check the function of the kidneys.
We can see that from the creatinine and urine.
I know. It's not essential, but it could be useful.
Serum cholesterol?
Not essential. We're thinking of another type of hypertension here, but possibly useful.
MRI scan of the brain?
Not required. It's of no value in this case.
Serum thyroxine?
Absolutely no connection with hypertension.
A barium meal?
Not required.
Uric acid?
Not necessary. If the uric acid is raised, there would be other symptoms.
Unit 5, Task 7. 1. Mr. Gumley.
Mr. Gumley, you'll have to have some investigations done to find out exactly what's causing your problem. Firstly, we need to get your chest X-rayed. Then for 3 mornings running, I'd like you to bring to the surgery a sample of the phlegm that you cough up in the morning. We'll be sending that off to the lab for testing to see if you have any particular germs present. Following that, it'll be necessary for you to have a bronchoscopy done. This is an investigation which involves looking down into your lungs through a tube. We'll have to admit you to hospital for the day to do it. It's not a particularly pleasant investigation, but you'll be given an anaesthetic spray before the tube is passed down into your lungs. Usually it doesn't take more than a few minutes, but it may last longer if they need to take samples of the tissue in your lungs, maybe up to 20 minutes. You have to take this test with an empty stomach, so you won't have any breakfast that day. You'll be able to get home again after the test, but you'll have to wait until the anaesthetic has worn off before you eat anything.
2. Mrs. Emma Sharp.
Because of your heavy periods, Mrs. Sharp, we must find out if you've become anemic, so I'll have to take a blood test.
Oh, right.
I think it will also be necessary for you to have a D&C done in hospital. We can probably do this as a day case.
Good.
It's a very simple procedure and just involves removing a small piece of the lining from inside the womb to find out why your periods have become so heavy. It'll also give us a better chance to examine you under the anaesthetic. It might also be necessary to do a pelvic ultrasonograph. This is a very simple test, which takes a special picture of the lower end of your abdomen to see if the womb is enlarged.
3. Miss Grace Donaldson.
From your symptoms, it would seem that you have an overactive thyroid gland. We can test this quite simply by doing a blood test to check the level of hormones in your blood.
4. Mr. Pritt.
Because you've been having this trouble with abdominal pain after fatty foods, I think you may have some stones in your gallbladder. You will need to have a special X-ray done. This is called a cholecystogram, and it will involve you taking some tablets before attending the X-ray department. They'll take an ordinary X-ray first, and then give you something fatty to eat, after which they'll take pictures of the gallbladder area to see if your gallbladder is working properly and if there are any stones present. They may also do an ultrasonograph. This is a way of examining your abdomen using a special machine which can show us pictures of your stomach and gallbladder using sound signals. It's not painful at all, and it doesn't take more than 5 or 10 minutes to perform.
5. Barry Scott.
Mrs. Scott, I feel certain that Barry has German measles. Sometimes we do a blood test to prove this definitely, but because he is only 2½, I am sure he wouldn't like to have a blood test done, and it would be safer to do nothing.
6. Mrs. Mary Locke.
Mrs. Locke, I think it's possible that you have a condition called glaucoma, which is caused by increased pressure inside the eye. In order to prove this, it will be necessary for you to have the pressure inside your eyes measured. We use a small instrument with a scale on it to measure the pressure. We'll put a few drops of local anaesthetic on your eye, so you shouldn't feel anything. The test only takes a few seconds.
Unit 5. Task 8.
This is the haematology lab at the Royal. I have a result for you.
Right, I'll just get a form. OK.
It's for Mr. Hall, Mr. Kevin Hall.
Right.
White blood cells 7.2. RBC 3.32. Hemoglobin 12.9. That's 12.9. Hematocrit 0.39. MCV 81. Platelets 264.
Sorry?
264. 264.
Right.
ESR 43 millimetres.
OK. I've got that.
Blood film showed neutrophils 60%, lymphocytes 30%, monocytes 5%, eosinophils 4%, basophils 1%.
Fine. Anything else on the film?
Yes, there are Burr cells present, ++.
Right. Thanks very much.
Unit 5. Task 16.
Your father's condition is quite poor. It seems that he's had diarrhea for 6 days, and this may have affected his diabetes. As you know, any infection can cause diabetes to get out of control. First, we have to check his blood sugar, kidney function, and level of salts. Because he's very dehydrated, we'll also be giving him some fluid. He'll have an X-ray done of his chest and abdomen. And lastly, we'll be checking to see which particular germ caused his diarrhea.
Right.